Hi, this is Dr. Tayani, ophthalmologist, board-certified oculoplastic surgeon at the Tayani Institute. Welcome to our session on Graves' disease. Today I'm going to talk about a somewhat unusual diagnosis called Graves', which we see as oculoplastic surgeons and ophthalmologists. We see them because the patients who have Graves' have a lot of ocular sequelae. So things that related to the eye that we have to deal with directly. So the disease is somewhat unknown in the sense that we do know it's an inflammatory condition related to thyroid gland. But interestingly, even though most patients who have the disease have it because they have a hyperthyroid, an overactive thyroid gland, there are some patients who have a normal thyroid and or even a hypo or an underfunctioning thyroid gland. So, but really the thyroid disease itself is not something that's the realm of an ophthalmologist. It's when that disease bleeds into or progresses onto affecting the orbit, the eyeball, and the periocular tissues around the eye. And the things that happen are swelling, inflammatory changes within the muscles, the fat pad within the orbit, that cause several things that really concern the patients. Thickening of the muscles, called the rectus muscles of the eyeball. There's 6 muscles around the eye. The most commonly affected are the the inferior rectus, which is the muscle underneath, and then the medial rectus, lateral rectus, and then the superior rectus. So the 4 recti muscles get involved. The fat within the orbit that sits in the orbital space gets affected, and eyelids get affected. So all of those things lead to things like a bulging eye. The eye is bulging forward. Number 2, there's mobility. The eye doesn't move properly, or relative to the other eye doesn't move properly. So that leads to double vision. And or one of the other issues is what we call lid retraction, where the lid retracts up or retracts down, depending on if we're talking about the upper or lower lid. So those conditions all lead to certain dynamics that we as ophthalmologists have to deal with. A patient with Graves' disease should be followed by an oculoplastic surgeon on a regular basis. Sometimes the disease does die out on its own and kind of basically just goes away and stabilizes. And sometimes it's very active and causes some serious eye problems. One of those is if the orbital contents gets too fibrotic and too inflamed, that puts pressure on the optic nerve. That's a emergency where we need to get involved and decompress the pressure that's being put onto the optic nerve. The way we do that is called an orbital decompression, which we basically create we open more space in the orbital volume. The way to do that is we actually fracture the bones around the orbit. We try to do the lower portion of the orbit first. If that's not sufficient, we go to the lateral wall. So an inside wall, underneath the eyeball, or the lateral, or all 3 of those bones are opened up to create more volume for the orbit, so the muscles, the fat, all of that has more space to live in, to allow less pressure on the optic nerve, which then allows the vision to be stable. Second thing is the movement of the eyes. If the extraocular motility is such that the eyes are not moving together and there's a significant amount of double vision, then the patient needs to undergo muscle surgery to align the 2 eyes together. And thirdly, if the eye does not close completely, you're at risk of getting a corneal ulcer or severe dry eyes. So we do something like extending the eyelid. If it's the upper lid, we do certain procedures to extend the eyelid by either elongating the muscle and or using special graft tissue to elongate the muscle. Same thing with the lower lid. If the lower lid is retracted down further back and pulling away and the eye is exposed, we do some graft tissue to place as what we call a spacer graft to increase the length of the lower lid, bringing the lower lid up. So those are the types of procedures that we do for Graves' disease. Most of the patients that have Graves do not require any of those extensive procedures. They just need to be watched and followed to make sure we don't have a corneal abrasion, an ulcer, or the double vision is not too bad, or it can be addressed maybe with prisms, and or decompression is not necessary to relieve the pressure on the optic nerve. That's a quick summary of Graves' disease. Please feel free to call us at 949-489-2218 or visit our website at Tayani.com. And otherwise, have a great day. This is Dr. Ramin Tayani. Thank you.